Why would anyone have to have half of their skull removed? Let's take a deep dive as to why this would ever have to be done. Yesterday I presented the case of a 67-year-old female who came to the emergency department after falling down a few steps at her house. She was taking her dog out for a walk and she tripped on a package that was sitting on her front step and landed on her face. When she came into the emergency department, she had this CAT scan which shows a few tiny little hemorrhages in her left frontal lobe of her brain. I mentioned that she's on aspirin and Plavix because she has a history of cardiac disease with stents placed. She was admitted to the hospital because of these CT scan results, and over the course of about 6 hours, she became progressively more lethargic and started profusely vomiting, so a repeat scan was done that shows this finding right here, demonstrating large bifrontal contusions of her brain. Well, that wasn't there on the initial CAT scan, so why the heck would that happen? So let's talk about why this happens. As you can see in this cartoon depiction, a strike on the front of the head can result in a brain contusion in the frontal lobe. This is a model of our brain that sits inside of our skull like this. So this portion of the brain is called the frontal lobe. If we look at the inside of the skull, you can see the frontal lobe rests right here on the base of the skull. If you hit your head on something, this part of the brain will bang on the base of the skull and can become bruised or have a contusion. The most common places to develop a cerebral contusion is in the frontal lobe and the temporal lobe because those parts of the brain rest on the skull base. And if you're on blood thinners or medications that prevent your blood from clotting properly, you can continue to ooze after the injury. Now, a bruise on your brain is just like a bruise on any other part of your body. So think of your knee, for example. If you fall hard and land on your knees, over a period of a few hours, it's going to continue to swell. And that's exactly what happens in our brain. It can swell too. But the problem with your brain is it's in a confined space. So if it starts to swell, there's nowhere for it to go. So what we typically do on any patient with a cerebral contusion is admit them to the hospital for close observation because we're worried that it could swell. And if a patient is on blood thinners, we usually try to give them medications to reverse the effects of those. But Plavix has no reversal. And once you stop Plavix, it can take up to 7 to 9 days to get completely out of your system. Now, this is actually a really common problem that we see on neurosurgical patients with head bleeds is patients that are on blood thinners that can't be reversed. How all these medications work and how they can be reversed are beyond the scope of this particular video. And if you do take blood thinners, it may be an important question to talk to your doctor about because emergencies and traumas do happen. And in my field, I see this almost every single time that I'm on call. That's exactly why if you're having some type of elective surgery or procedure, your doctor will ask you to stop this medication in preparation for that surgery. Okay, so let's get back to our patient. Since there is no reversal for Plavix, she was observed and this hemorrhage continued to expand. And with continued bleeding became progressive swelling of her brain, which is why she became more sleepy and began to vomit, which is a sign of increased intracranial pressure inside of the skull. Now, I mentioned at the beginning of the video that she was a GCS of 15 on arrival, and that stands for the Glasgow Coma score, which is a way we classify how alert and awake someone is. This is how we calculate this score, and if the GCS is less than 8, we usually electively intubate someone to protect their airway because they're not awake and alert enough to protect it on their own. She went from a GCS of 15 on arrival to a GCS of 7 when this CAT scan was performed, so she was emergently intubated and placed on life support. Now, there are things that we can do medically to manage increased intracranial pressure, and those things include elevating the head. That way the patient's venous flow out of their brain is increased, and that will reduce the pressure inside of their head. There are 2 types of medications that we'll predominantly administer to help reduce intracranial pressure. One of those is called mannitol, and the other is called hypertonic saline. Those are both hyperosmolar medications to reduce swelling inside of the brain. We will also sedate the patient to reduce the amount of brain activity, which will also in turn reduce the intracranial pressure. If the brain is not firing as much, it won't swell as much. If the GCS is less than 8, we'll also consider placing something called an intracranial pressure monitor to see what the pressure is inside of the head so we can get better control of it and know what we're treating. That's also called an external ventricular drain, and I've talked about it a lot on this channel. But that's a surgical procedure, and you said that she's on blood thinners. You're exactly right. So what do? We can actually do a blood test to check and see if Plavix is actually working on a patient. That's called a P2Y12 platelet reactive assay. What? Plavix actually works by blocking the P2Y12 receptor. That's a receptor that works in our body to cause our platelets to clot. So if you block that receptor, your platelets won't clot and your blood is thin. Does that make sense? Here's the crazy part. 4 to 30% of patients that are on Plavix do not show an appropriate response. It's called Plavix resistance, and you can check it by this assay. You mean to tell me up to 30% of the population could actually be taking this medication, but it doesn't even thin the blood? That's exactly what I'm saying. And we checked her P2Y12 assay, and it was actually showed normal platelet function. So she was taking this medication, and it wasn't even thinning her blood, which in turn means that she could have an emergency surgical procedure. So she could have an intracranial pressure monitor placed within reasonable safety to see what her pressure is. And if it is high, we can even consider going in and removing those blood clots, or doing a decompressive craniectomy by removing the blood clot and removing the skull to allow the brain to swell. Now, I will say that those types of surgeries are life-saving surgeries, but carry a significant amount of morbidity and mortality. These are the real challenging and ethically charging decisions that we make as neurosurgeons every single day. Just because we can save someone, should we? You see, the frontal lobe of the brain controls decision-making, judgment, and personality. So if her pressure in her brain was really, really high and life-threatening, our only option to save her life would be this life-saving surgery. But most likely, she would never be the same person ever again. And that's if she even survived. We have to have these types of discussions with patients' families all the time, and they are never easy. And that's another reason why, as a potential patient, it's important that you have these discussions with your family so they make the decision for your health care that you would want in this circumstance. Having those discussions makes it a lot easier on your family that have to make those decisions for you. Luckily, in our patient, we never really had to have that discussion because once we placed the intracranial pressure monitor, we were able to control her ICPs medically, meaning she didn't have to have surgery. Now, you might ask, why did her hemorrhage expand if you just told me her Plavix wasn't working? The truth is that any contusion can potentially expand, and she probably had some effects of the Plavix in combination with the aspirin. Like most severe traumatic brain injury patients, she had a lengthy stay in the intensive care unit, and she did in fact need extensive rehabilitation after her hospital stay. And even 6 months later, she still cannot function independently. She still has trouble with her language, comprehension, and complex cognitive tasks like paying her bills. And if you are a survivor or have a loved one that suffered a TBI, you know that there are persistent lifelong effects of that. Brain injuries are invisible, and March is Brain Injury Awareness Month, and continuing to raise awareness is important. Another case of patient-focused and compassionate care. Stay tuned next week, and we'll go through another case.